So they had me change into a gown. She came back in. Poor Brady had to like experience this whole situation with me. I mean, I swear she was traumatized for years from this. But anyway, so they checked me and she goes, yeah, you've dilated. And I thought she said none. And I was like, what? And she goes, you're at 9 centimeters. And I was like, what? Like, I definitely was not expecting to have been 9 centimeters in that short amount of time. Like, at this point, I mean, it had only been like an hour, if that. That was a kind of like silent labor situation. I don't really consider it that, but my current doctor thinks it was silent labor. Not only was I a month early, but the pain was different than being induced. So it was just more of like extreme discomfort and making it very difficult to breathe. And yeah, I drove to the hospital at 9 centimeters dilated, apparently, because like when I showed up, I was smiling. They didn't believe that I was in labor. When they checked me, they were like, oh my gosh, you're at 9 centimeters dilated. We were all shocked. My husband was 45 minutes away. I had to call him to like rush there. He called his mom, had his mom come to watch our daughter Brady. She worked like right up the road, but I guess it took her a minute to get there because she had to get approval. She literally got there 2 minutes before my husband did to get Brady. Brady saw like all this traumatic stuff. I mean, I'm sure she's like traumatized forever from that. She says she doesn't believe it now, but I know for a few years she did. She would always say like, Mommy, remember when Austin was born? Oh yeah, I remember. But she was there for the majority of it. It was crazy. It was wild. Um, and yeah, so my husband's mom got there like 2 minutes before he did. He got there and they said Austin's heart rate was starting to drop and I needed to push. And next thing you know, he's here, like not even like 5 minutes after my husband showed up. So it was just crazy, wild, fast, terrifying. I told my current doctor everything. She got my medical records and she was completely terrified of me with this pregnancy. So she has sent me to maternal fetal medicine. Every 2 weeks I go there. So far, I have been there, I think 5 times. My first appointment there was when I believe I was like 10 weeks and they didn't have my first official appointment scheduled there until I was 16 weeks or almost 17. And then I went at 19 weeks and then I went yesterday at 21 weeks. So I think I've been 4 times there. The first time I went was just a consultation. When I went for my 17-week scan, they checked my cervix was 3.8, which they said is great. Same thing at my next one. But at 17 weeks, they said that the baby was growing a week and 2 days ahead. 2 weeks later, at my next appointment, which was at 19 weeks, they said that he was only growing a few days ahead. So I don't know. I don't think that that's a sign of like IUGR or anything like that. They didn't mention any type of concern as far as that goes, at least not right now. My regular doctor, not the maternal fetal medicine doctor, said that that's pretty normal for babies at this stage because at this rate they're growing, you know, based on genetics, not, you know, like that's why they do the ultrasound so early on to get an accurate due date. So they don't seem concerned right now. I think IUGR is more something that shows up like later on, you know, in the 3rd trimester or something. As far as my cervical length, the last 2 times it was 3.8 and this time it was 4.2, which is great. They told me at my 17-week scan that I had low-lying placenta, which it's not placenta previa. Placenta previa is where your placenta is completely covering your cervix. Mine was low-lying, which means it was only partially covering, and it was just sitting extremely low near the cervix. So they kept an eye on that. At my 19-week scan, they measured and they said that it looked like it was moving up, but it still wasn't enough for a smooth vaginal delivery. So at this last appointment, they didn't do a formal measurement. I don't know if she just forgot, but when I went to the room to talk to the doctor, she kind of was just like, they didn't do a formal measurement, but it looks like your placenta has moved far enough up for a safe vaginal delivery. She's like, I don't want to get your hopes up, but we'll do a formal measurement next time to see. She's like, I didn't see it, in the way of your cervix. So that is a good sign. So they're going to do a formal measurement in 2 weeks when I go back, and I will let you guys know. My cervical length was 4.2. And then she told me that the baby was having PACs. She says nothing to be concerned with right now, that 1 to 3% of women have babies who experience that in the womb, and they all turn out perfectly healthy, and the PACs end up being benign. She said it could be caused by caffeine, electrolyte imbalance, and like several other factors. I told her that I had thrown up the night before, so possibly could have been, an electrolyte imbalance because I hadn't really eaten too much. And then I had a chocolate like beverage before my appointment to hopefully get a good like profile shot of the baby during the ultrasound. I was hoping to get him a little bit active, but I guess that was not a good idea because of the caffeine in the drink. So I'm going to change a few things. I'm not going to drink Coca-Cola, even though I've been having cravings like crazy. If I do, I'll drink caffeine free, but really just try and stick to like water and just eating healthy, and, try not to eat like too much because like now the baby's like pushing everything up and it hurts. Like it's definitely more difficult to eat. It's harder to breathe. So just, I'm just going to hope for the best. Like hopefully if I change a few things, because this was the first time, yesterday was the first time that they had even seen something like that, I'm just really hoping that it goes away by the next time and it's nothing to worry about. PACs are premature atrial contractions. They did 3 different scans of the heart, and they said that every so often there would be a couple extra beats. So they said it's nothing to be concerned about. But if I can try changing my diet and certain things, then that'll probably be better for the baby. So yeah, I'm very stressed about it a lot. It's like, if it's not one thing, it's something else. Like my cervical length has been good this whole time. They told me about the low-lying placenta. Now that it seems like it's most likely resolved itself, it's like they want to add something else on. I was originally only supposed to be going to the maternal fetal medicine doctor until I was at 24 weeks because they said if my cervical length looked good, they didn't see it shortening at all, then they wouldn't really consider me high risk for preterm labor at that point. Because I guess the majority of women who experience preterm labor and delivery, there's some sort of sign, earlier on, like by 24 weeks, they will know. So I thought I was only going to be going until 24 weeks. And then they said, as far as the IUGR thing goes, they were just going to have me go to my regular doctor. And if she saw anything, abnormal with the growth, then they would send me back to maternal fetal medicine. But now, I guess because of the low-lying placenta and all these extra factors, and now that the baby's having PACs, they are having me go every 2 weeks until the end of my pregnancy. So it's just crazy. Like I have to drive an hour and 10 minutes every time I go, which is not a problem because I just want to know that the baby's okay. And I feel like I should just look on the bright side. Like who wouldn't want to see their baby on an ultrasound every 2 weeks? How many other women get to see their baby that often? Like, I mean, usually you only see your baby like 3 or 4 times on ultrasounds unless you go to the 3D, 4D. So I should just look on the bright side of that. But if any of you guys have experienced low-lying placenta, your baby has had PACs in the womb, anything like that, even like cervical length shortening, anything like that, please reach out and just give me any sort of peace of mind, any information that you guys have. I've been on forums and stuff, but because we only told very few people that we're pregnant with our 3rd baby, I don't really have many options for advice. Like a lot of the people who do know, they haven't experienced anything like this. So it's just like I don't know, like it kind of makes me feel weird even like having the conversation with them, because like they don't know what to say to me. And then that just gets frustrating. So if um if any of you guys have advice, please reach out. Also, if any of you guys are currently experiencing, a baby that has IUGR, or, you're showing signs of preterm labor, just don't hesitate to reach out. Comment below. I can also leave my email address. So if you actually want to have a conversation, I'm very open to that. Like, I'm at this point where I'm just hoping this is like more of like an open discussion type thing and we can help each other. But yeah, I think that's about it. I think that's all I have for tonight. Thank you guys so much for watching, and I will catch you next time.